So what does the Supreme Court June 2012 decision on the Affordable Care Act mean for consumers? Well, essentially what it means is that things haven't changed from what they were the day before the decision. So for example, dependent coverage to age 26 remains in place. No pre-existing conditions for children 19 or under, that remains in place. Preventative care covered from the first dollar, that remains in place. No lifetime limits on essential health benefits, that remains in place. And the 80% mandated minimum loss ratio, that also remains in place. Now, in 2014, things will change a little bit. That's when the health insurance exchanges come into play. That's when you will see the qualified plans come into place. And those plans will also have an 80% minimum loss ratio requirement. We will also see, for example, guarantee issue for everybody. So today, where it's only age 19 or under where there's no pre-existing condition, this will provide guarantee issue coverage for everybody. No underwriting whatsoever. And we would expect as a result of that to see a significant increase in the number of people entering the individual health insurance space. What's not known is what impact, if any, it's going to have on the actual cost of insurance and the cost of care, and that remains to be seen. And will be monitored and looked at, over the years to come to see if it has any result for that. Now, statistically, it's interesting. At American General, we have seen a tremendous increase in the sales of our supplemental accident health products over the last few years. So products that help cover the cost for an accident or critical illness, we've seen the sales of those products increase to help cover co-pays and deductibles in the underlying health insurance plans. Why is that important? Well, it's important because about 60%, based on surveys, of bankruptcies were caused as a result of a medical illness. And interestingly, about 3/4 of those situations, the person had underlying health insurance and still needed to declare bankruptcy. And so as we look forward to these qualified plans in 2014, each of those plans still has a maximum out-of-pocket family liability of up to $11,900 per calendar year. And so we believe the need for these types of supplemental coverages, while they're important today, will also be important tomorrow.